Hello everyone again, I'm Valentin Zbant. I know it's a funny name. I'll explain a bit later why is that a funny name. To be honest, I'm a bit nervous. Hopefully in a couple of minutes I'll get rid of those emotions, but yeah, fingers crossed. So let's get going to the presentation. To start off, who am I and why am I speaking here? First of all, I'm a Lego enthusiast, guitar enthusiast, and front-end enthusiast. Also, full-time UX designer. I work in the design field for about 10 years. I had my time to get all the things in place, to have some time for mistakes, to have sometimes to repair my mistakes, and now I think I'm on the right path, evolving on the right direction. I've said that I have a funny name. I'm from Iași, from Romania. For those who don't know exactly where Romania is, we're actually here, and I live in the northeast of Romania. It's a really beautiful city. The bad thing, we don't have highways, and we cannot explore that easy the rest of the countries. So Iași is the second most populous city in Romania. We have 500,000 citizens, and the interesting thing, it's the third most active IT city in Romania. I work at CGM, Compu Group Medical, which is a German company founded in 1987. Is the best provider of IT solutions of higher quality and efficiency in the healthcare system. We're actually the first ones to provide healthcare solutions in Germany, and also we have extended to other countries such as France, the Netherlands also, and now we're starting step by step to enter in Romania also. So, why an electronic ePHR, a personal health record? I think everyone has encountered or is used to paper format healthcare, which I don't know if you share the same idea, but for me at least is not so handy, because all the time I'm afraid not to lose something when going to a doctor. Also for me, for my parents, for my grandmothers, and so on. Also, when you go to a new physician, to a new doctor, it's really difficult for that doctor to see exactly what you had. It takes a lot of time, and yeah, things might get delayed. Also, it's really bad to be part of a crowded waiting room. Nobody likes to be caught in the middle of a never-ending queue. And also, to avoid those situations, we either send the necessary medical documents via email or WhatsApp, and that's not so secure, because I think we all heard that WhatsApp is the target of hackers and so on. And what are the advantages of an electronic ePHR? Well, actually, it's easy to access. Either if you have it on your laptops, on your tablets, on your mobile phones, or you have native applications, it's easy to access them, and also easy to understand, because all today's software is translated into let's say, more natural language. It's easier to process all the medical data and to see and understand if you have some problems, or you need to go to a doctor, or you need to do something. Also, a really interesting case that I have studied also for my bachelor degree is the case of emergency. When a person has, let's say, has a not so happy event and ends up in an ER, maybe without the ability of talking, that doctor needs to know what should he or she do in those cases. And I don't know if all the doctors have time to go to all the sheets from the medical dossier and to see all that happened to that patient. The world is evolving, and nature, mankind, technology also evolving. We do our best to ease out our day-to-day tasks in secure and attractive ways. I don't think that we want everybody to see everything about us. We should be in charge of what we share to the world, and especially with our personal health record. I will start having this in mind with the technical presentation. Despite our evolved, complicated cognitive abilities, the original primitive brain functions didn't go away. If anything, they became more important. And I think that without any hesitation, technology is evolving. I think you also a lot of things about artificial intelligence that they might become the next thing, but it will be really difficult to replace a person. And this is why the primitive brain functions are, let's say, on a top class. So what are the UX challenges in the electronic PHR? During my period with CGM, I had the chance to work with an electronic PHR. This is the application that was released first in Germany. Okay, so I've read that. I will stop my camera just to see the presentation bigger. Is it okay like this? Hopefully. I will continue until somebody says so. Okay, so coming back. With the electronic PHR, CGM Live, Patientenakte, which means personal health record, a shorter word in German than in English. This is more than an electronic patient record. All your health data is stored in the highly secure CGM medical cloud. We store your data, and we crypt it so that it's difficult for hackers to access it. Record both medical and vital data. Actually, in this application, the user can add the personal weight, the pulse, the blood pressure, and so on and so forth. So it's also medical, but also personal health record. During the time that we developed here in Iași this application, we encountered the followings. First of all, language. I'm Romanian, my colleagues are Romanians, and we developed a German application, also French applications. And to be honest, it's really difficult to think something in your natural language, translate it into English, and then translating it again into German. I'm not a German speaker. I get the help from my colleagues from Germany. And for instance, we had a funny case in which add, the simple verb, in German had around 10 letters or something like that. So we designed a certain screen, and we had to change the whole perspective because the words are bigger. And here it is, a small example. We had it in English, it was shorter. We also had some data to add, and it was indeed a bit difficult to adapt it. For my next challenge, adding new features. I think all of you which worked in developing a software encountered this situation in which you think a certain architecture, you have a certain flow, but somebody from the management team, from the board, from I don't know, also from the user side, comes up with a great idea, and you find out that you need to add that new feature. You need to find the perfect way to involve that feature in the whole flow in such a way that the user is not lost during the experience, during the journey, and also you have all the things in place, and you keep the user all the time within your application. Our greatest enemy, the limited time. From my experience, I don't know a company that doesn't have a deadline like yesterday. Everything needs to be delivered as soon as possible, as good as possible, and without, let's say, with a limited number of improvements. Also, this time is not so good regarding the documentation. So in here, either you lack documentation if you have taken that project or continued that project because there wasn't time, maybe there wasn't will, and when you do new features, when you implement new features, also it's difficult to find time for documentation because maybe the management team wants new features instead of documentation, and so on and so forth. You'll hear me a lot saying the management team because I have worked already at 2 product companies and a lot less in startups or personal projects. Another challenge is to have the same feature different platforms. Within this electronic PHR application, we have the web version, the native Android version, and the native iOS version. So 3 different platforms, they have to do the same. And it is difficult because, for instance, for the web part, we have different screen sizes for desktop, tablets, and mobile. And also the responsive mobile is not exactly the same to the native versions. In here, also another challenge is to have the platform behaviors adapted, the features adapted to the platform behaviors. For instance, on an iOS, you'll place the descriptive text in a certain place different than Android, in order for the native users to find it in the same place, because each and every user for a certain platform has a certain mental model. And all the time they will know, okay, this is an explanatory text for that part, this is another section, and so on and so forth. Another challenge that I have encountered during my experience are the tasks. I've placed within brackets the Jira tasks because in here we use a lot of Jira tasks, not other task management tools. And I think in here there are multiple cases. Either the task is written as a solution already without leaving the UX team or UX designer to come up with a solution. Everything is strict, and you have to do that and that. And coming from management team or people that are not so technical might be a suggestion instead of solution. And from this point on, you need to discuss a lot with them to see why they propose that, to see the benefits, and so on and so forth. And if I mention the management team, another challenge is communication with the team, with the management team. First of all, because the technical side may lack. They are experts on the management side, on the financial part. They know exactly what they want, and they want it yesterday. So you need to communicate with them to find out exactly what is the need, how can you fulfill that need, what's the problem, how can you solve it. If you have time to pursue UX interviews, if you have time to document everything that you have encountered, and so on. Communication within design team, when there's a large team, of course, there's ideas that from time to time tend to contradict themselves. And in here, you need to take a step back to see exactly everything that the people are proposing, to see who's right, who has good input to write it, and as a final step, to have a common solution, not an individual solution. And also, I think the most interesting one so far, communication with or challenging the dev teams. When an UX designer or UX team comes up with a proposal, with let's say some screens with a flow, the nicer part comes in discussing with the dev teams, because I think everyone will try to find the easier way to do it, to implement it, but we need to have in mind one important thing, and that's that the user is the most important person when we are talking about softwares. We are not doing the software for ourselves, we are doing for the user, and the user has the main voice, let's say it. So I think I skipped a slide.
And it's how did you solve the challenge of showing the data according to different time period, showing the entire patient history versus a single stay at a hospital, for example?
Okay, so thank you for your question. It's a really good one. Indeed, we also encountered this problem because we have a lot of data. For instance, we can talk about chronic disease people, which have a lot of entries. For instance, in, I don't know, maybe blood pressure or blood sugar, or what other examples. In here, we had, for instance, a default view with time period in which the user can, first of all, select the time period in which he or she wants to see the data. And what we did as an extra also involved a graphical view with a chart, and this we figured that this will help the user have an overview of what's the evolution of the inputs that he or she had, and also come to the doctor with a more detailed overview. So to answer your question in a more precise way, we combined the entire patient history with categories, with so we had a separation between documents and between inputs that the user added. And for those inputs, we also had another category, and that being the type of input that the user had. And there we split it into time periods.
So the next one is, could you share the electronic medical standards you followed to develop that app? This is from Lucia.
Yes. To be honest, I don't exactly understand what you're referring to. I will try to answer. First of all, thank you for the question again. In here, we had some situations in which we needed to be careful in order not to be a medical, to break a certain medical standard in the German jurisdiction, let's say. We are trying to become a medical device so that we can interpret to show the user colors, for instance, for a certain part of the values if the user has a bad condition or a good condition or needs to contact the doctor, but this needs to come after the approval from the German state. The main focus of the application was to help the user have all the time a personal health record. Some of the medical documents that he or she could share with the doctor, because within this application it is possible to do so. And we try to, let's say, break from the regular fitness app, which can take your day-to-day weight, blood pressure, and so on, and have it something more for the medical part and not for the fitness part, let's say. Hopefully I answered at least to a part of the question.
But thank you for that, Lucia. We have another question from Sarah. How did you overcome those challenges?
Thank you for the question, Sarah. Well, step by step. And we based our entire activity on communication and transparency. For instance, within the design team, we have a certain tool that we are using in order to collaborate. We have Abstract that helps us have different versions of the file so that we don't ruin each other's work. Also, when we have new features, we do a lot of brainstorming session, and within those we come up, this is at least what we are saying, with the best solution possible for the user and for the business, because we're trying to mix those two. It is indeed difficult, but we are doing our best. And with, let's say, the management team, also based on communication, listening a lot, trying to adapt our, let's say, technical language to a more common language in order not to get too technical, but also to understand the need. And with the developers, it's, I think, an ongoing discussion here. We are getting along. We are, let's say, seen as the creative team that has a lot of crazy ideas, but we have one saying here: we are not doing art for the sake of art. We are combining the technical possibilities with the best solution that we can come up with. So we are trying to understand them and asking them to try understand us. And hopefully sometimes we get in the middle. It is indeed maybe an ideal place, but yeah, sometimes we, let's say, we let them do their way. Sometimes they let us do our way. So it's a give and take relationship. Hopefully I answered the question.
Thank you, Valentin. We've got another one here from Chrissa. Did you use preferential privacy algorithm for data protection?
Thank you for the question. Regarding a more technical approach here, I'm afraid I cannot offer something really detailed, because this is another team that is taking care of this. Being an own product company is also an advantage in this part, that we have colleagues that are helping us and taking this from our shoulders, and yeah, we base on each other and we rely on their work. So I'm here, I cannot give you a really exact answer. Sorry for this.
Okay, we have one that just shot right to the top. It's from James. James is one of our speakers from the US. And James is with GE. And the question is, how does a patient's view of the data information architecture differ from a medical professional's view of the same records?
Thank you for the question. So The application that I have presented is actually only meant for the patient. This is the patient's application in which the user can add and have indeed a certain information architecture. And in here I want to mention that depending on the health value that the user adds, or on the type of document that the user adds or receives from the doctor, it is indeed a small difference because we needed to adapt the view to the needs of that health value or document. For doctors, on the other hand, we have other solutions that are in place for a long time, and doctors in Germany use it, I think, for around 20 years. UX-wise, for sure, we would want to interfere also in that area, but the doctors are really satisfied with the result that they have so far and will not change for anything in the world. And this is good for us because we can focus on the patient side and we can think of innovative ways to deliver the information for the user. And to answer your question, on their side being, let's say, an interface that is adapted to 20 years ago, it is indeed a different view. We also have some challenges in the backend part because the data is modeled in a certain way and we need to adapt that data for the user. Hopefully I answered the question.
Okay. Yeah. Thank you. We've got another one here. Hopefully you understand this question. This is also from Frederick, and is how far the specificity with regards to doctors' specialties did you decide to go? For example, the cardiologist is not interested in the same data as an orthopedist. So how did you design the default interface for them to take that into account?
Thank you for the question. This is also in the same area with the question before from James. Using another solution for doctors gives them a lot of room for choosing exactly what part of the documents they want to see. Also, from the patient side, we have a feature that allows the user to either mark documents as private and share the whole PHR with a certain doctor, or individually sharing some categories or some individual documents. And in here, it's also based on communication. For instance, if I get a new medical result, I will share only that with the doctor that I want to go. Or for instance, in the example given by Frederick with the cardiologist, I can share only my my blood pressure results so that the doctor can see exactly what's been going on with me, if there is a need to have an appointment, and so on. I hope I have answered the question.
Okay, and then we have one from Leanne. What were some of your most successful UX solutions in your app?
Thank you for the question. Ooh, more personal one than the others. It's like asking a parent to name a favorite child. It's difficult to say let's say one in which we spend a lot of time is actually this module with sharing the data with the doctor, allowing the doctor to have read views on my electronic PHR. Because in here we had to adapt this to the mobile device, and I think we all know that we have a limited space. We have different interactions within the platforms, and in there we had to think of a solution to also allow the user to singly select and also category select, and that was the challenge. That was the most part. Let's say most successful, but I wouldn't say most successful, but yeah, most time consuming. Hopefully I have answered the question.
Okay. Valentin, what we're going to do, yeah, Tom just mentioned it. You are picking your favorite child, so you just did that. Well done.
Yeah.
What we'd like to do is there's two more questions that's just popped up, and then after that, I think we've kind of jumped the gun. Actually, we were due to take a break now, but if everyone can stretch their legs and maybe have some screen time, we're just going to answer these last two questions, and then we'll be back here for 12 o'clock. So it gives you enough time just to grab another coffee and answer any emails that you have from work. But the question we have from Bob's also one of our speakers. And she's got a question here. Beyond displaying data for patients, did your app include features for things like medication adherence, either through reminders or tracking, or other adherences or treatment?
Thank you for the question. So far, no. We had this in, let's say, in a proposal state. One of the next features will be to be able to reorder a prescription that you had in the past. So, for instance, if one of the patients has a certain prescription that takes month by month, the user will not go to a physician, stay, let's say, in a never-ending queue and then having the prescription. This will be possible using the application reordering the medication. Sorry. For the overview of the medication, we have another app, a partner app, that the user can view data within the electronic PHR, but regarding whole medication plans, I don't know, reminders, also tracking, this is done within this application. So the electronic PHR is the core of multiple other applications within CGM. I hope I have answered the question.
Okay. Thank you. And then we have this last one from Frederick. What was the most challenging part during the user research phase for you?
Thank you for the question. The part in which we had to rely on the translations, because the user research part and also the user testing part was done in German by our German colleagues. And although we tried to follow some, let's say, specific things, we were also careful with the details to see exactly where should we place our most targeted age range, what is our focus within the users, if we are basing ourselves on having users that are a certain age and have for sure some difficulties within using the application. Now that the EU will have that accessibility law, we need to recheck the whole application. We tried to keep in within the accessibility laws and having an application as easy to use as possible. I think the most challenging part was to figure out an age range in which we should target our audience. Hopefully I have answered your question.